Are you able to hear me?
Yes, sir.
Yes, sir.
Yes, sir.
Yes.
Good morning to all my students, and I request you all to be very careful for the next 2 to 3 weeks. Very crucial period in our fight against the second wave of the pandemic. I hope most of you have been vaccinated and they are able to take the second dose also. If not, please see that it is done at the earliest. Things are looking very grim. And please don't go out of the house unless it's absolutely essential. As far as possible, you can wear a double mask, the face shield also, and at all times you maintain that 6 to 8 feet distance. Maximum needs are some essentials like milk and groceries for us to stay alive. And those who go out of the house, you please tell them to maintain the COVID appropriate behavior at all times. Things have turned very bad. We all have to be responsible. Don't behave irresponsibly. Then coming to one thing, I'm not very happy with the way you have written your answers. Good thing is you all must have taken the exam very sincerely. I'm very happy for that. But I'm not happy with your answers, especially the heterometric regulation of cardiac output. Not very satisfying. Even cardiac cycle, the heart sounds part is not good. And when it comes to the, I have corrected only 15 papers. When it comes to conducting system diagram, that is fine. But the pacemaker potential, after telling so many times, the slow response action potential and the slope there, and we draw the diagram like this. Okay, we draw the slope like this, and then we explain this part. We label it as 4, 0, and 3 phases, and we tell the HCN channel. Only 2 or 3 have written. Oh, depressing, for me to teach you all. Really, seriously. I feel depressed sometimes to teach you all. You all look so intelligent in the class, so much action you will do, and very few have got the desire to improve, put in that hard work. So many times we told that out of 15 papers, 3 or 4 have written. So depressing, I get dejected sometimes. Why should I spend so much time? Most of the colleges, I have taken, I think, 25 classes. They finish the entire CVS chapter in 25 classes. Why should I take the strain, get sore throat, take extra classes? And I take an extra class on Sunday. When the class is finishing, I see that 60 students are there online. You have no fear, no sense of responsibility, no shame. Principal and HOD is taking. None of you will come. Out of 170, 1/3 of the class is there, 2/3 are absent. And after taking classes for you morning and evening, I myself had a very bad sore throat. I'm telling it was COVID, everybody around me are positive. I went in for 3 days isolation. I got myself tested and it came negative last Friday. I really feel, why should I do all this for you all? When there is absolutely no reciprocation from your side. Just you are going through the motions, thinking already wearing that white coat, you all have become doctors. Or you have the bloody excuse of online class, offline class. You are ready with excuses for canceling the class, not coming to the class, postponing the exams, canceling the exams. Ready with excuses, all of you, most of you. You don't want to put in that extra effort from your side. You have to innovate, you have to adjust, you have to adapt to the situation. What to do? It would have been nice if you all were here. When you all were here, I have seen your performance. I don't know. I really don't know what else I should do. Very depressing, when I start correcting the papers. Nothing will be written there. How many times we tell those important points which will help you in future in your clinics? Nothing is written there. You won't even attempt that question, that part of the question. And heterometric regulation, any sorry, it is Frank-Starling's law, operation of Frank-Starling's law. Stroke volume is directly proportional to end-diastolic volume, which is determined by venous return, which is determined by so many factors. The pumps there, the thoracic pump, the muscle pump, the cardiac pump. In the cardiac pump, you have visa turbo, visa fronto, blood volume, gravity, venomotor turn. How many times I would have told you? Huh? Hey, there are doctors and there are doctors. I hope you know the difference. At the end of the day, everybody will write for cough same medicine. Antitussives, antihistamine, and antibiotic. But the doctor who's writing, he will not know. He will just be copying something. The other doctor who has the good clinical knowledge, he has the ability to discern that cough can be because of so many things. The medication I'm giving can cause problems. So please, you all, please wake up. Don't fool yourself. If you're trying to fool the world, it is okay. But don't fool yourselves, thinking you are all doing a very good job, very great, you are reading. I had enough of nonsense from you all, most of you. So stop fooling yourself. Mimmalni meer mosam chesukoddandi. That you should not go to that level of pretension. So please know where you stand and start working hard. It is not some rocket science or anything. You just have to sit at home and start reading more. Okay. So today we'll start with a very different topic in cardiovascular system. This is, if you see the chapter which we are discussing, it is called as cardiovascular system. Okay. So even though these two are one and the same, cardio, can anybody tell me what do you understand by cardio part there? What does it imply? What is it referring to?
Heart.
Heart.
It is referring to the heart. Okay. So there is basically, you have a heart which is like a pump, which is providing a pressure head to pump the blood round and round the system of tubes. So what is the other part, the vascular part? What do you understand by the vascular part? It is referring to the blood vessels. Conduit, C-O-N-D-U-I-T-S. In simple words, it is nothing but a system of interconnected tubes. Okay, so in our first class, we had discussed about the functions of the cardiovascular system. And the most important function is, it is a transport system. It helps to transport the oxygen, nutrients, and other substances, hormones to the various tissues. And it also helps to pick up and transport the waste material from these tissues to the various excretory organs, that is the lungs and the kidneys. Okay, so the system of tubes there plays a very important role, obviously, right? So give me a minute here. Okay, chalo. Right. So if you remember, and in almost the first class on this cardiovascular system, I had told you about the circuit diagram of the heart. Do you all remember this? The circuit diagram of the cardiovascular system.
Yes, sir.
Where you have, I have divided it into two hearts, the right heart and the left heart, and then it goes like this. Do you remember this diagram?
Yes, sir.
Yeah. Can
Yes,
you
sir.
all just please open the diagram, and you'll remember that in between
Yes, sir.
we had the blood going to the various organ systems like this. Okay. So the two systems, the pulmonary system, pulmonary circulation and the systemic circulation, they are arranged in series. But the individual systems, organ systems, like say the blood flow to the liver. Blood flow to the liver, what can we call it as?
Hepatic circulation.
We can call it as hepatic circulation. So similarly, the blood flow to the lungs ఏమంటామండి?
Pulmonary circulation.
Pulmonary circulation. The blood flow to the kidneys,
Renal circulation.
the blood flow to the various abdominal organs, blood flow to the various abdominal organs.
Enteric vessel.
Starts with S. Enteric nervous system. Because it is there inside the wall of the intestines, it is called as enteric nervous system. But the blood flow to the various organs like pancreas and large intestine, small intestine, what is that called? It starts with S.
Splanchnic.
Yeah, it is called as splanchnic circulation. It is called as splanchnic circulation. Okay. So all these circulations are parallel to each other. So why it is parallel is this parallel arrangement of the subcirculations in the systemic side. It helps that the blood flows with the same pressure to all these organs. The oxygen concentration, nutrient is same, whatever is delivered. And if needed, we can control the blood flow to one organ and divert it to the other organ. The total output from the heart will be same. Say, for example, at rest, something happens. You want to say that blood flow to the skin increases. So what you will do, that 5 liters, what is there, you will decrease the blood flow, the body will decrease the blood flow to the splanchnic circulation and divert it to the skin. Even during exercise, even though there is a 6-fold increase in the cardiac output, even though there is a 6-fold increase in the cardiac output, that entire 30 liters is not getting equally distributed to all the organs in the same percentage as it was being distributed at rest. The 30 liters which is being pumped out in exercise, which is the main organ involved in exercise, which is the main tissue there.
Skeletal muscles.
Yeah, it is the skeletal muscles, is it not? So blood will be flowing more to the skeletal muscles, more to the lungs and heart, and more to the skin also, because the temperature regulation has to be done. So when most of this blood is diverted there, it has to be at the cost of some other thing, is it not? So blood flow to the kidneys, blood flow to the splanchnic circulation will decrease. So the same 30 it is like doing the budgeting in the house. When your income is fixed at, say, let us say some 50,000 rupees per month. So you are having some 10,000 for groceries, 10,000 for rent, 10,000 for paying some loans, and 10,000 for other things, and 10,000 you are saving. Suddenly 1 month something happens and some extra expenses comes. Something has to be paid, somebody fell sick. So the same 50,000 is there. What you will try to adjust, is it not? So grocery, rent, and all, you can't do anything. So savings part you will decrease and you will divert it to the extra expenditure which has come. Same thing the heart is doing. The same output is there. It cannot go beyond a certain value. Okay, so that whatever is being put out, it is readjusted. At the cost of one organ, another organ will get more blood. The heart cannot compromise blood flow to brain and heart. The blood flow to the brain and heart cannot be compromised. Okay, so kidneys also vital organ, but still maybe you can decrease because it is receiving so much blood flow there. Almost 25% of the cardiac output is going to the kidneys at any given point of time. Okay, so like you understood this concept. So how that is done? That is done because of the parallel arrangement in the subcirculations. Okay, so that is one thing. So we will now start our discussion on the vascular system. There are two things you need to know here. One is you have to understand something called as a structure function relationship. Structure function relationship. We can also call this as functional anatomy. You can also call this as functional anatomy. This is called a structure function relationship or functional anatomy. So I think I have mentioned this at some point. A very almost self-explanatory term. Each and every organ or cell has got a particular function, special function. And that special function will help it to perform special structure. Sorry, it is having a special structure. And that special structure will help it to perform a particular special function. Yeah. Now we will look at the vascular system of we will look at the vascular system in three parts. Okay. So what are those three parts which we look at the vascular system? Say, let us. You think this as the whole heart, big. To both sides are there at the same, right? So what has to happen is life should be colorful, kadante. What has to happen is from so from the heart, the blood will go Okay, now you tell me. So I have divided the vascular system now into three parts. This is the first part. This is the second part. Okay, and this is the third part. Right? And I'll make one small modification. One more thing I have to add here. Now, who will? So this is for the sake of convenience. I have not divided the heart into two parts and all that. Okay. So and then I have not drawn the lungs. You just imagine this is that. So circulation starts from the systemic circulation will start from the left ventricle and come back to the right atrium. Now I have divided the system of tubes, that is the vascular part, into three. What are those three parts? Can anybody? What is it? 1, 2, and 3.
Arteries, capillaries, and veins.
Veins and capillaries.
ఏంది అర్జెంట్ ఏంటి? మాస్క్ వేసుకున్నాను లేదా చూసుకొని రమ్మన్నాను. నాక్ చేసిరా ఇంకోసారి వచ్చేటప్పుడు. What is first part? What is the second part? What is the third part? You all said something.
Systemic circulation. Systemic circulation. Pulmonary circulation.
It is systemic circulation. I have divided into 3 parts.
Sir, from the heart to the organ and within the circulation within the organ.
ఇవన్నీ నాకు వద్దు. 1 ఏంటి, 2 ఏంటి, 3 ఏంటి? Why I have drawn
Sir,
that in red?
arterial part.
Arteries,
capillaries,
and veins.
Capillaries and veins.
Yeah, this is the arterial system. Arterial part is a high pressure system. It contains of arteries. Second one is the microcirculation. Probably the most important part. So surprise. You will always think arteries are more important. Microcirculation is the most important part. And the third one is the venous side. Please don't draw these diagrams in your exam. You can draw it for the sake of understanding. So you have the vascular system, especially on the systemic circulation part. You can divide it into 3. The arterial system, the microcirculation, and the venous system. So the arterial system will take blood from the heart, from the left ventricle, by a series of tubes which are dividing again and again and again to smaller and smaller branches. It ultimately comes and join and breaks down into very small divisions called as capillaries. Across the capillaries, the exchange of material is going to take place. Then these capillaries will join and form bigger and bigger and bigger tubes. Finally, you have the biggest one in the venous side, that is the superior and inferior vena cava, which is going to bring the blood back to the heart. Okay, so the vascular system, you can divide it into 3. Arterial system, the microcirculation part, and the venous system. Now, we'll go back to the ఉండవయ్యా నేను పిలుస్తా. Now we'll go back to this thing. Okay, if you look at the structure of the blood vessel, the blood, see, I'm getting so irritated because he's coming in when I'm not wearing a mask. Not wearing a mask, I'm talking. I must have even really put so many droplets of saliva into the air in this room, and that guy wants to come in without knocking. Anyway, so if you look at the wall of the blood vessel, I think you all know that the wall of the blood vessel, there are 3 layers. Okay, and these 3 layers, depending on which part of the circulation we are talking about, and depending on what function that particular part of the circulation has to be performed, some modifications will be done in these 3 layers. Okay, so can anybody tell me, ఇది కూడా పంచపాండవులు ఎంత మంది అని question? So how many layers are there in the blood vessel?
3 layers.
ఏదో చెప్పాలమ్మా.
Tunica, intima, media, and adventitia.
Tunic అంటే ఏంటండి?
It is coat.
మీ వైట్ కోట్ మాదిరి అది కూడా కోట్. Sorry about that. It was about some patient who was relative with my Vedama, who was admitted anyway. So, right. So we were talking about the structure of the vessel wall. Okay. So it is very important that you understand the structure of the vessel wall and try to correlate it to the function that is being performed, right? So basically, whether it is an artery or a vein or a capillary, these three layers are going to be there with some modifications, or it may be totally removed, shaved off. Okay, so what are those three layers which are there? From outside to inside, or my favorite is endothelial cell. I don't know why I'm very fascinated by that endothelial cell. So much research going on the endothelial cell, which we'll talk at some time in our discussion in the cardiovascular system. So from outside to inside, if you go, there are three layers or coats. So you have tunica intima, innermost is intima, middle one is tunica media, and outermost is tunica adventitia. Okay, so this order you should not. And also, if you observe the diagram which I have focused, between the first and second layer, there is one big layer of definite layer of elastic fibers, which is called as internal elastic lamina. Okay, and between the second and third layer also, there is another elastic membrane called as external elastic lamina. Quickly, you take down this diagram. Quickly. If you are having the facility of screenshots, also it is okay. You quickly take it down. Spend some time fast. Don't waste time like you used to do in the class. తొందరగా తీసుకోవాలి. I'll also try to draw with you. Let me see. Please remember, I am drawing with a mouse. పెన్తోనే అది అంతంత మాత్రమే. I am drawing. I am being little more daring, and I am drawing with a mouse. ఏం పట్టుకోవాలో జీవితం. So I will leave it to you all. On a scale of 1 to 10, how much marks you will give me for the masterpiece which I have drawn with the mouse. I tried to make it as colorful as possible. I should be colorful. I think somebody called me. Hand raise ante entandi. You finished or you're giving marks for me?
Finished, sir.
Finished. So Dikshita, 10కి ఎంత ఇస్తావమ్మా నాకు? Keeping
Sir,
in
9,
mind.
sir.
Wow.
10, sir.
I'm sure that doesn't deserve a 9. Yeah, మస్కా కొడుతున్నావా నన్ను?
Sir, no, sir. Mouse to వేయడం చాలా it's difficult to draw with mouse, sir.
I don't know. I don't know whether I should be telling you also. Somebody called me. I cut the I cut the thing and I typed I am in class. అది ఏం ఆటో కరెక్షన్ I am in love class అనిపోయింది. అది ఏందో ఇది ఆయన ఏమనుకున్నాడు. Immediately told sir it is auto correct. Sorry. 9కి 10. సరే భావన సిరి ఎంత ఇస్తుందో. Before it becomes too much, I'll delete it. Bhavana Sirina, roll number 10.
Yes, sir.
ఎంత ఇస్తామా మార్కులు? Is wondering
Sir,
what.
9, sir.
I think I'll stop asking you all. My thing, this is a 5.5 or maximum 6 out of 10. అది కూడా ఎక్కువ. 5. So done. You drawn the diagram? Finished, man? Okay. So you can see that now comes the important point. Okay. We can look at this structure of the vessel wall and try to see it as what are the components? Basically, the vessel wall is having 4 components. Anybody? Vessel wall is having 4 components. What is the first cell? Starting from inside out, we'll go.
Epithelium.
Endothelium.
So one is the first component is the endothelial cell.
Endothelium.
Second component. What is there between the first and second layer?
Basement line.
Elastic fibers. Second component is elastic fibers. What is the third component?
Smooth muscle.
Smooth muscle
muscle
fibers.
fibers. Very important. This smooth muscle, which is present in the vascular system, it is called as vascular smooth muscle. ఏమంటారండి? All of you unmute and tell with me. VSM. My dear students, please talk in sentences. The smooth muscle which is present in the blood vessels is called as vascular smooth muscles.
Smooth muscle present in blood vessel is known as vascular smooth muscle.
Fast, it should be fast now. One more time.
The smooth muscle
present in blood vessels is known as
Called as vascular smooth muscle. It is one of the most studied visceral smooth muscle. Smooth muscle which is present in visceral organs is called as visceral smooth muscle. And again, you have certain subtypes. Say, for example, like I already told you, the smooth muscle which is present in the blood vessels, it is called as in the wall of the blood vessels, it is called as vascular smooth muscle. So similarly, with same common sense, taking it forward, common sense concept, trying to apply the same logic to the tracheobronchial tree. What is the smooth muscle present in the tracheobronchial tree called as? Come on, please. The word I'm looking for starts with B. Dash smooth muscle.
Bronchial.
Branchial smooth muscles.
Branchial kaada. Bronchial. BRO.
Bronchial.
Yeah. Bronchial smooth muscle. Okay. So bronchial smooth muscle is the smooth muscle which is present in the tracheobronchial tree. Very important. Because it is this muscle which will go bronchoconstriction and bronchodilation, and that is the one which is causing so much problem in bronchial asthma, and also in the current COVID-19 pandemic. If you see, many people after they recover, they are having severe cough, especially if they are asthmatics from before. So it is all got to do with that bronchial smooth muscle. Anyway, so moving on. So the smooth muscle, the visceral type of smooth muscle, which is present in the vascular system, it is called as vascular smooth muscle. It is very important. Even under resting conditions, it will be in a state of partial contraction, and we call that as vascular smooth muscle tone. I hope you're writing down this terminology. Even under resting conditions, there will be some amount of contraction, partial state of contraction in the vascular smooth muscle. That is called as vascular smooth muscle tone. Yeah. What is sympathetic tone? What is parasympathetic tone? Anybody? What is sympathetic tone and what is parasympathetic tone?
So due to the action of sympathetic and parasympathetic nerve fibers, if the tone increases, then it will be sympathetic, and if it is suppressed, then it is parasympathetic.
It is not increases. I'm just asking you, what do you understand by the term sympathetic tone, Bhavana?
Sympathetic tone will be, sir, in stress conditions like flight, right, where muscle activity has
It
to
is
be
not under
increased.
stress. Even under resting conditions, some impulses are going via the sympathetic nervous system to the heart or cardiovascular system. That is called as sympathetic tone. Even under resting conditions, some impulses are going via parasympathetic system to the cardiovascular system, mainly heart, because parasympathetic innervation of blood vessels is very little. Okay, so that is called as parasympathetic tone. I hope you are writing down all this. So three things I introduced. Even under resting conditions, in the vascular smooth muscle, there is some amount of contraction. What is that called as, Swati? What is that called as, Swati?
Vascular smooth muscle tone.
Vascular smooth muscle tone. Excellent. Chandana, what is sympathetic tone?
Even in resting conditions, some impulses may enters into the sympathetic system. Then it is known as sympathetic tone, sir.
Yeah, via the sympathetic system to the cardiovascular system. That is called as sympathetic tone to the cardiovascular system. And Nirmala, what is parasympathetic tone?
Even in resting condition, there are some parasympathetic nerve impulses to the cardiovascular system that is known as parasympathetic tone.
Okay, simple question. To the heart, which tone dominates? Sympathetic is dominating or parasympathetic?
Parasympathetic.
It is the parasympathetic is dominating. So you should think of sympathetic and parasympathetic as husband and wife, and parasympathetic is dominating, so parasympathetic is the wife. Story of all our lives. Anyway, so that was a joke, right? So then, okay. So you have endothelium, you have elastic fibers, then you have smooth muscle, that is the vascular smooth muscle. What is the fourth component? Collagen fibers. The fourth component is collagen fibers. Okay. So, and apart from these 4 important components, you will also have the fibroblasts innervating into the tunica intima, nerve fibers innervating, and some proteoglycans and other extracellular matrix which can innervate. Okay. So now the next part is very important, right? So this is another diagram, nice diagram, where you can see it's almost they've tried to make it into a 3D diagram, right? You have he has stripped off from outside. Stripped off means peel off, like peeling an onion or peeling an orange layer by layer. Okay, onion layer by layer. So you have the outer connective tissue, then you have elastic membrane, then you have smooth muscle, then you have internal elastic membrane, then you have basement membrane, then you have the endothelium. Okay, so nice diagram, I felt. Huh? This is another look at the blood vessels, right? Wall of the blood vessel. Okay, I'll come back to this. Please remind me about vascular smooth muscle function sometime else. Okay, this diagram is showing you how an artery looks like, a transverse section, how much of thickness is there in the wall, total wall thickness, and in this is the middle layer in the tunica media. Lot of vascular smooth muscle fibers are there. Okay, and this is a capillary. So thin it is. Outer 2 layers have been stripped off. Outer 2 layers and the tunica adventitia has been stripped off, and tunica media has been stripped off. Only what is remaining is tunica intima. So a single layer of endothelial cells resting on a basement membrane. That is the only thing that is present here. When you come to the vein, if you see, it is also having all the 3 layers: tunica intima, tunica media, tunica adventitia. All 3 are there. But the problem is that if you compare it to the artery and see the thickness wall here and the wall thickness here, very thin it is in comparison to the artery. That you have to tell. The vein wall thickness of the vein is very less compared to the wall thickness of it is only 1/3 of the thickness. Rule of thumb. In general, that is what we say. So that is one thing you have to remember. Then this diagram is most important. Okay, this diagram is most. This diagram shows you. He has taken the 4 components on one side: endothelial cells, elastic fibers, smooth muscle cells, and collagen fibers. And he has also looked at the internal radius, okay, wall thickness. So internal radius is from what is inside, leaving the wall thickness. Okay, so this is the wall thickness, this is the internal radius. Okay, so you have the components. So he has divided the red. What does the red signify? What does the blue signify?
Red
Which
for
part?
artery.
Artery,
The
blue is
artery,
for
blue
vein.
Yeah, Jansi. This red part is the arterial system. The blue part is the venous system. And this is the capillary, mainly the microcirculate. Yeah. So if you see here, if you can remember these values, it is well and good. But I would like you all to concentrate on this part. Okay. So if you see here, if you look at the aorta and large arteries, the 4 components are there: endothelial cell, elastic fiber, smooth muscle, and collagen fiber. But if you compare it with the other parts of the arterial system, say medium artery, arteriole, and precapillary sphincter, which component is very high in the aorta and large arteries?
Sir, elastic fibers will be more.
Elastic fibers are there in more percentage. They make up more. Their content is more. So that is why Complete that sentence. Anyone can
They
complete.
are known as elastic arteries.
Aorta is known as elastic arteries.
They ante they बोले तो क्या है निर्मला?
Large arteries, sir. Like
Aorta and large
Large
arteries.
arteries
Yeah,
and aorta.
aorta and large arteries are called as elastic arteries. Any other name for that?
Wincastle vessels.
Wincastle vessels. And when it was your turn to write about econometric regulation, we said ergo, very few have written that. Out of the 15, I have corrected. Anyway, leave it. So why to go into depression? So the medium artery, if you see, almost everything is there in the same proportion or percentage. It is endothelium is there, elastic is there, not as much in the aorta and large artery. Smooth muscle is there, collagen is there. When you come to the arteriole, thickness is very much. Internal diameter is not that much. The thickness is quite high. It is 20 microns. It is more than the internal diameter. And why it is more? Because the proportion of smooth muscle is very high. Arterioles can constrict so powerfully that the entire lumen may be blocked. And they are the ones which help to regulate blood flow. If need be more blood flow, they will dilate. The vascular smooth muscle will relax, they will dilate. It is called as vasodilatation. If need be, they will constrict, vasoconstriction, and they will the lumen is decreased and blood flow will decrease. And how it is, to what extent this is decreasing, we will learn when we talk about hemodynamics. Okay, so you can see the modification, and here also some modifications are right. So this aorta and large arteries are called as Wincastle vessels, whereas the arterioles, that is where there is maximum resistance to blood flow. Anything which is moving will be met with resistance. Okay, literally and figuratively. Anybody is moving up in his career also will be met with resistance. With personal experience, I can tell you. Anyway, so when blood is moving in the vascular system, it is going to be met with resistance. When air is moving in the airways, in the tracheobronchial tree, it is going to be met with resistance. Okay, so all parts of the vascular system will offer some resistance, but the maximum resistance to blood flow is seen in the arterioles. That is why arterioles are called as resistance vessels. Arterioles are called as resistance vessels. And then you come to the capillaries. If you come to the capillaries, what is the modification done?
The outer two layers are removed. Outer two layers are removed.
Outer two layers have been stripped off. Very thin walled. This is an ideal arrangement for exchange of material between the blood and the interstitial fluid. Okay, so arterioles are called as resistance vessels because they offer maximum resistance to blood flow, whereas capillaries are called as exchange vessels. Why capillaries are called as exchange vessels? Because exchange is taking place across the capillaries. Okay, when veins, the venous part, everything is there except that the proportion is very less in comparison to the arterial side. And veins are having a lot of compliance. They can be stretched to a greater degree. Okay, so they have a large capacity to store blood. So veins are called as capacitance vessels. Emetarandi veins ne?
Capacitance vessels.
Capacitance. What are capillaries called as?
Exchange vessels.
Exchange
What
vessels.
are arterioles called as?
Resistance
Vessels.
And what are aorta and large arteries called as? Elastic vessels are Wincastle. I hope you have written down this in your notebooks. Okay. Now I'll give you the option because it is all for the students and by the students and of the students. I'll show you 3 diagrams. This is the first one. This is the second one. And this is the third one. Which one you would like to draw?
First one.
I will leave out the third one, whether it is this one or this one.
First one.
All are for first one.
Yes, sir.
Hmm?
Yes, sir.
Yes, sir.
Okay. Right. అదే రిజల్ట్స్ ఏమైనా వచ్చినాయా? ఇంకెవరికైనా కాల్ చేయి. త్రివేణి ఎవరికైనా కాల్ చేయి. Sure. Are you done, ma? There is another class. There was some confusion. Today, 9 to 10 class was missed. Dr. Sharwani will be taking a class now up to 1 o'clock. Have you all finished this diagram? Say something. Raise your hands.
Yes.
Yes, sir.
Do it a little fast. Okay. Yeah, who is this? Conclude today's class. So today's class was mostly one advice from me as usual, which hopefully you will all wake up. And then we started a discussion on the vascular system. We divided the vascular system into three parts: an arterial part, a capillary part, or be more precise, the microcirculation part, and the venous part. And we saw that the blood vessels are having three layers or tunics or ports. From inside out, you have an endothelial layer, that is tunica intima, tunica media, which is the smooth muscle layer, and tunica adventitia, which is the fibrous or connective tissue layer. And in between the layers, you have an internal and external elastic lamina. So basically, there are four components in the blood vessels: the endothelial cell, the elastic fibers, the collagen or fibrous tissue, and the smooth muscle cell. And depending on the function that particular part has to do, it will undergo some modifications. Say, for example, in the aorta and large arteries, there is more of elastic fibers, so they are called as elastic arteries or vein-causal vessels, which is a very important thing, which we call it as visit or go, which is making the intermittent pumping of the heart into continuous flow. Then you have arterioles are having more of smooth muscle, and if this smooth muscle contracts, you have almost obliteration of the lumen, and they offer maximum resistance to blood flow, and they are the ones which regulate blood flow to the various capillary beds. So they are called as resistance vessels. They function as stopcocks or pinch cocks, like valves. And then you have capillaries. Capillaries are very thin walled. Okay, almost nothing is there except the first layer, a single layer of endothelial cells resting on a basement membrane. It's an ideal structure for exchange of materials between the blood and the interstitial fluid. So the capillary is called, they are called as exchange vessels. Okay. Then you have the veins. Veins are thin walled. All three layers are there, but the thickness is very less compared to the arterial side. And veins have got a great capacity to store blood. At any given point of time, most of the blood is present in the venous system. Around 60% of the blood is in resting conditions. So the veins, because they have a great capacity to store blood, they are called as capacity. So right, I can ask, you can go on to the next class. Please read and come for tomorrow's class. Okay, read about Starling's forces.